arm and a leg.
Shadrach Miti, KTN News.
Tomatoes Health and unions in the health sector, including the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU, have faulted the Social Health Insurance Act of 2023, terming it a punitive and vendor-driven venture set to impede access to healthcare in the country. Speaking during a joint meeting to assess its viability, the union said the act as is contradicts the tenets of universal health coverage and remains discriminatory, especially against those in the informal sector who might not be able to comply with registration and contribution that requires upfront payment from these demographic, among other concerns. Our health and science reporter Gloria Milimo with more.
Solidarity forever.
Speaking in Nairobi during a meeting to establish the implications of the Act, the unions led by the Kenya Medical Practitioners, Pharmacists and Dentists Union Secretary General Dr. Bimji Davji said the Social Health Insurance Act of 2023 curtails the attainment of universal health coverage and is driven by profits.
We realize that the memoranda that were submitted by Kenya Medical Association, by the civil societies, by KMPDU, by FKE, by all these bodies, they were not looked into, and the advices, the proposals were not considered. And that's why we find this bill, as much as it comes out as a Social Health Insurance Act, it's more, and it seems, and it's quite clear that it's a vendor-driven venture.
They have also raised concerns over what they describe as punitive and discriminatory nature of the Act, which seeks to deny government services to those who fail to show proof of compliance on registration and contribution. They warn the move will infringe on the right to health as provided in Article 43, Section 1A of the Constitution, which also includes the right to healthcare services, including reproductive health.
We have not even taken consideration of those households that perhaps are not even living beyond, they can't even get a food on a daily basis. They can't afford even a 20 bob for their children for food. How then, when we put a moratorium that if you do not pay upfront for 1 year, where do they get that fund? That means, and that's where there is also the burden of disease. In looking at women, the burden of disease, particularly reproductive health diseases, they go to hospital many times. The out-of-pocket, we have not factored in.
The law is supposed to complement the society. The law is supposed to be made to make life in the society meaningful. It should not be the other way around.
Other concerns, according to the Doctors' Union, is the withdrawal of the comprehensive medical cover for civil servants and county employees. They argue that the medical scheme is an outright attempt to privatize public funds. They also say the Act as is vague and also grants legislative roles to the Cabinet Secretary for Health. They warn that this move allows the Cabinet Secretary to come up with more regulations and clauses which are not part of the Act, contrary to the law.
Legislation is vague in that manner. It is not by accident. It is intentional. The reason is that there's a lot that is hidden from the Act that is left for somebody else to be the one that is to fill up.
For now, it is a matter of wait and see whether the petitions challenging the Act will lead to a review by the courts. Gloria Milimu, KTN News.
And ODM leader Raila Odinga has called on all elected leaders in his party to focus on working for the